Okay, so I'm gonna knock on the door, I'm gonna enter. Hi, my name is Catherine. I'll be your nursing student for today. Can you state your name and date of birth for me, please?
Karen Medina, 0924-2000.
Okay, well today I'm gonna be performing it's the heart, neck, peripheral vascular, and also the lymphatic system assessment on you today.
Okay.
All right. So let's go ahead and start by getting some information from you. So can you tell me, have you ever had a heart murmur before?
No.
Okay. Any other cardiac issues?
No.
Maybe like diabetes?
No.
Okay. What medications are you on?
No medications.
Okay. What about smoking or vaping?
No.
Okay. So then let's go ahead and start with the assessment with inspection, and then after that I'm going to palpate and also auscultate your skin and your heart, okay?
Mm-hmm.
And also your lymphatic region. Okay, so I'm gonna go ahead and I'm going to start with your legs first, then I'm gonna work my way up, okay? All right, so I'm looking at your legs. Can you go ahead and turn them towards me, please? Okay, and can you turn the other way? All right. I don't see any bruising. I don't see any vascular veins sticking out. Looking at your other leg. Okay. I'm looking at your other leg. Okay. I'm going to go ahead and look at your upper legs. Okay. Then can you turn this leg that way? All right. Looking at this leg. Okay. All right, so I do not see any varicose veins sticking out. Also, looking at the color of your legs, they look normal. I don't see any stenosis, which means you could have insufficient flow of blood, and also you would have a discoloration, so they could be bluish or they could be like a paler color. All right, so now I'm going to go ahead and I'm going to pull this back down. All right, I'm going to look at your arms now, checking them. All right, and then can I look at your nails as well? All right, so I don't see again any stenosis. They look a good pinkish color like they should be. All right, same with these. Okay. All right, and then I'm also going to look at your face. No stenosis there. All right, so can you turn your head to the right and look up for me, please? Okay. I'm also checking for pulsations in your neck, and I do not see any on this side. Can you turn to the left and look up, please? Okay, I do not see any pulsations there as well. So now I'm going to go ahead and I'm just going to check overall your temperature of your body, which can also be an indication if there's insufficient flow. All right. So using the back of my hand. Again, I'm sorry, my hands are a little cool. All right. Okay. Checking your legs. We're going to start with the upper portion. Okay. All right. Okay, so the warmth of your skin felt normal. I'm going to go ahead and check. Okay. And I do not see any edema. Normally with like your peripheral vascular, if I'm going to see any edema, I'm normally going to see it on like your lower extremities because they hang down. Can you tell me also, do you do a lot of sitting during your occupation?
No.
Okay.
I try to stand up.
All right, because that can also cause you to have edema from long periods of sitting. Okay, so now I'm going to go ahead and I'm going to feel for any thrills or heaves, which are abnormalities of your heart. Okay. All right, and for this lower area that I'm going to be checking, can you go and pull down your gown for me, please? Probably to about like here would be a good idea. Okay, so then I'm checking. Okay. Okay, and then can you lift your breasts up? Because I just need to get underneath.
Okay.
Okay. Sorry again, my hands are cold. Okay. So I did not feel any thrills or heaves. Can you go and leave that down for me for a little bit? Okay. So now I'm going to go ahead and I'm going to auscultate. So these 5 points, I'm going to be checking your aortic, your pulmonic, your herbs, tricuspid, and then your mitral. Your mitral is actually at the apex of your heart, and your aortic would be at the base of your heart. Okay, so I'm going to go ahead and start by cleaning off my equipment. Okay, so I'm going to go ahead and I'm going to start at the aortic. And it can be found, to start off with, it can be found in the left midclavicular line at the second intercostal space. And now for the last spot, can you go and raise your breast up again so I can get underneath? So I did not hear any abnormalities. What I'm looking for is a lub-dub sound, which is what a normal heart pumping would sound like. Also, if I did hear any abnormalities and I need to take your pulse, I would take it at the apical site, which is found at the midclavicular line, and then at the 5th intercostal space, at the apex, okay? All right, so at this time, I'm gonna go ahead and check your carotid arteries. I'm gonna do one at a time to keep from occluding and then causing you to potentially pass out, okay? So I'm gonna go ahead and have you look to the side, okay? Okay, and then Can you turn to the other side? Okay, so they both feel bilaterally equal, and I would rate them at a 2+. Alright, so next I'm going to listen for any like whooshing sounds or any bruise in your neck, and I'm going to go ahead and check at the mid-cervical, which is right here. I'm going to check at the base of your neck, and also right here in this angle.
I think she's upstairs. So.
You want us to go upstairs?
Okay. So we're going to go ahead and start
I'll go
that now.
grab her and see what she says. Because I know you're in here. I need to go find where she is if she's still in here.
Okay. So we're going to start with this side, then work to the other. Okay. Okay. You turn that way.
How you guys doing? No.
So I did not hear any bruise, any whooshing sounds, which is a good sign. It means we didn't hear any abnormalities. Okay. All right. So this concludes our assessment for today. Thank you for coming in.
Thank you.
Do we